Thank you, Madam Chair. And let me just say thank you to all of the witnesses for what you're doing here. I stood on the Capitol steps and heard you all earlier today, and thank you for that. Uh, Doc, let me go to you. And I think it's important for the American people to understand why this is so important and why we're in our 15th day of the shutdown, because we're saying no health care, no vote. And what that means to the millions and millions of hardworking families every day. So, can you briefly, because I know we have other questions here, share with us how Medicaid or Medicare or the Affordable Care Act has been important to the work you do in saving lives of hardworking Americans who have benefited because Democrats fought hard to get that affordable care. Just tell us what that means.
It's very important because it allows the people to have access to quality care. It allows them to have a primary care physician who can follow and maintain their health records. If you recall, prior to this, people are going to go to the emergency room for health care. There's no continuity of care, no history of prescriptions. At times, people are prescribed things that are contradicted to them because they have no history of their knowledge. And so, what I see is going back to what Representative Tlaib said, this is a caring and compassionate country. Americans are when they feel it's deserved. I think what has happened, we've got the term underserved confused with undeserving. So people feel they're not entitled to it because they don't deserve it. You know, we, people have got confused underserved with undeserving. And so if they think you're undeserving, they don't care whether or not you have the care or not. I recall a brief story in Georgia, a young father. Someone stole his car. He didn't have enough insurance to replace it. So he walked 12 miles a day to work just to keep his insurance. When it hit the news, people started a GoFundMe page for him, and he got $23,000 in 2 days because he was deserving, because he was willing to go to work. And I've been at 6 or 7 programs this year, of course, Representative Horfels have been there just explaining the need and being accessible so people can explain. So if we can make them understand that everyone is deserving of proper health care, that'll help us a long way.